So in 2021, we came up with this idea of telerespiratory services, and there was another group out there that was doing telerespiratory in kind of a different way. And so when we originally started Encore, one of the things that we had started out and sought to do was telemedicine. So telemedicine, 10 years ago, we were trying to do it in nursing homes, and really had this idea that we could put respiratory therapists anywhere with telemedicine. And we were probably 10 years too soon to the party, which tends to be a theme sometimes. But what we did was we launched this telemedicine model and trying to do RTs, telemedicine all over the place, especially in nursing homes. And it was too early. So then we pivoted. We started doing software. We started doing Nexus. And then in 2021, when COVID happened, there was this massive shortage of respiratory therapists, which you all know. And then we recognized that there was, number one, a shortage of respiratory therapists, but also number two, there was a lot of burnout that was happening with respiratory therapists. Number three, there was a challenge for DMEs that nobody wanted to upset their respiratory therapists because it was so hard to find them. They were all jumping ship, going to travel assignments to make money. And so we had this kind of struggle that was happening. So we said, what if we started a telemedicine, telerespiratory model where we could help support not just doing services for a DME, but really to do outcomes. And so our telerespiratory services are a little bit different than what you see in the industry. Everything we do in telerespiratory is about outcomes and data. So if you think about that, we've got oxygen program, Oxygen 360. We've got a Vent 360. We've got a Vest 360. All of those are kind of the 360-degree view of how we manage that patient. And so you might be thinking, how in the world could you do an oxygen program in an industry where there's almost no margin in oxygen anymore? And the answer is pretty simple. What we've come up with is this concept of this idea that if you use respiratory navigators, respiratory therapists to reach out to oxygen patients and identify gaps in care, number one, we provide better care for the patient. Anybody who's been in the industry for a long time knows that back in the day, the early days, we were sending respiratory therapists out to every single patient every month, even oxygen patients, nebulizer patients. I remember as a teenager going out with my dad's company, and they didn't want to pay for a babysitter, so they would send me out with a respiratory therapist after school. I'd ride my bike to the warehouse, and I would go spend time with the respiratory therapist. I would go in patients' homes and just see how valuable a respiratory therapist was to the patient. And really, it wasn't about, to me, it seemed like it wasn't about I never thought about how smart the respiratory therapist was, how much they knew about respiratory. But what I noticed as a teenager was how much they cared about people. And so what I recognized was that caring piece, whether it's a nebulizer patient, oxygen patient, a vent patient, that part of just caring and making that emotional connection makes such a difference in a patient's lives. And oftentimes patients who don't see other people, so just a little bit of love goes a long way, and a little bit of being there and having those conversations. We can't do that with nebulizers and oxygen anymore because of the cuts in reimbursement. So we came up with this model to say, how do we get back to some of that? How do we get back to where we could clinically manage an oxygen patient and use that to identify when that patient needed other services? So when does that patient need ventilation or airway clearance or anything else? And so the whole concept of telerespiratory is built on this idea that if you clinically manage oxygen patients, you can identify gaps in care, and it drives your future ventilation, airway clearance, and every other kind of business, right? And so medications. So what we've done is we built this model where we do outreach on the oxygen side to the patients that are under contract with a DME. So you're a DME, you've got 1,000 oxygen patients, and we take those 1,000 oxygen patients, enroll them in our program. So our respiratory navigators are going to be doing outreach to those patients. What we're looking for is, are they taking their medications? What are their symptoms? Are they having problems with hypercapnia? Do they wake up with headaches? Do they have any kind of issues that are going on that would indicate that they've got high CO2s or that they've got secretion clearance issues? So we're doing things like the CAT assessment, where we're tracking symptoms to recognize that, hey, this patient continues to struggle with cough, phlegm, chest tightness, things that indicate there's something going on with secretion clearance. So how do we identify that, get it back to the doctor, and then be able to tell a story to the doctor that, hey, this is our oxygen patient. They're struggling with this, and they're struggling with cough, phlegm, chest tightness. They can't get their mucus up. They've had multiple respiratory infections, and so we really think they need to be on some kind of airway clearance device. So it kind of opens the door to have a conversation with the doc about a service that the DME offers that the patient needs. So you're just connecting gaps in care to solutions. Now what that does is it builds clinical credibility, like I was talking about with Nexus before, is that clinical credibility is that when you build that deeper level relationship with a doc, where now they look at you as not just somebody coming in looking to get an oxygen order, but somebody coming in helping solve problems for their patients. Once you do that a couple times, then what happens is it starts to put you at a different level than the average DME rep. Right now, the doc looks at you differently. As I got a problem, this is who I'm going to call. And so when that starts to happen, then now all of a sudden it's much easier to say, hey, here's 20 of your patients who 10 of them are doing good. 5 of them are struggling, maybe not taking their medications. You want to get them in to see them, and so that we can see if they can get on the right medications, or we can get them taking their meds again. And then here's 5 that need airway clearance or ventilation or a new medication that your pharmacy offers if you have a pharmacy. So it just starts to solve problems for patients. And when you become a problem solver, then you're looked at differently, and you start to get more referrals and a better, deeper relationship with the physician. So the Oxygen 360 model is really about how do we use data and outreach from clinicians to identify gaps in care, take those gaps in care, build it into a story that we could take back to the doc that tells them how their patient's doing. And then when we find patients that are struggling, who are in the red zone, then we tell that story to the physician, show them what the gap in care is, what the problem is, and then help make the kind of bridge into what do they need, whether it's a flutter valve, so we can see if that works, and then if it fails, we can look at airway clearance, or if it's ventilation, looking at does this patient need to be on non-invasive ventilation, and what's the pathway to get them there. So the whole idea being that if you just look at the oxygen business by itself, investing more money in managing oxygen patients probably doesn't make sense. If you look at your respiratory business as a whole, to say if I invest money on oxygen populations, who, by the way, most of my airway clearance patients and my ventilator patients were on oxygen first. And so if I invest in my whole respiratory population to say I'm going to collect data, tell a story, build the story for the physician, build deeper relationships with the physician. In doing that, then as you invest in managing the oxygen patients clinically, you identify gaps in care, you grow your vent business and your airway clearance business over time. So that's really the model, is that we've proven we can identify a large number of oxygen patients. It's anywhere from 10 to 30% of your oxygen patients that you have on service today that need some other advanced therapy, airway clearance or some kind of ventilation support. And so if we can identify, say it's 25% of your population, and then you just convert 10 or 15 or 20% of those patients that we identify to those services, then you have a huge ROI for what we're talking about. So the idea being that you can't just look at it in silos, oxygen, ventilation, airway clearance. You got to look at your complex respiratory business as a whole. And when you start to do that, again, you start thinking about it as a strategy that I'm not going to see a return in 3 months, but in a year from now, I'm going to see a solid return. My sales team's going to be better. I'm going to have deeper clinical relationships. I'm going to have the ability to clinically manage my oxygen patients, which none of my competition does, so I can go out and sell that. And I'm going to have a much bigger airway clearance and ventilation business, and that's going to start to grow. So it's about building the foundation of having a team that know how to have deep levels of conversations with docs, clinical conversations, and then using that to grow the business over time and to grow credibility. So when you do that, the oxygen business becomes a feeder for the rest of the business. And we are not mining patients. That is a bad word in my mind, and a lot of companies have done that over the years. It's not a mining exercise. This is a clinical management model where we identify true gaps in care and struggles that patients have, and we connect the right patient to the right device at the right time. And in the process of doing that, we have better outcomes and we grow the business for the DME. So if you do it and do it right, then you're going to see results. Now, one thing I'll tell you it's not a magic bullet, right? If you have as a DME, if you have a sales team that doesn't know how to talk about the clinical side or ventilation, it's going to take a while to get there. And so it's not like you could just go in with these notes and all of a sudden you're going to get a bunch of orders. What needs to happen is you've got to have this kind of foundational understanding of ventilation and how to talk about ventilation or airway clearance, which we can help with. And we work with a lot of companies who are just kind of getting started in that space. We work with some companies who have been doing it for years and are the best of the best. And so it's really doesn't matter where you're at in the process. We can help you build and grow. But just know that if we throw a program like this at your business that is not already doing okay or not already starting to have those conversations, it's going to take some time. It's going to take some investment, but we will get there. If you do know how, and we specifically roll this out to territories where you've got strong sales teams and you've got people that know how to have these conversations, then you're going to be very successful. We could take a good rep to great. We could take a great rep to outstanding. We can take an average rep to a good rep. So we can really raise the bar for the sales team to be able to take them to the next level. In doing so, the investment that you put into it, you're going to get an ROI in the first 12 months. But now in year 2, 3, and 4, you get huge ROIs. And that's really where this strategy piece comes in, is not only are you now collecting data and you've got outcomes, but now you're growing your business from within organically. You're building a sales team that understands the clinical side and can talk the talk. And in doing that, your whole business grows and you get an ROI. So it's a win-win all the way around. And then on the Telerespiratory side with ventilation, you might say, well, if I do that, and now all of a sudden I go from not having that many vent patients to having a bunch of vent patients, then what's that going to do for my clinical department and my respiratory department? We're not ready for that. And that's where Vent 360 really comes in. Vent 360 as well as Vest 360 are two products where we clinically manage patients for you. So if you think about a vent patient or a vest patient, we can do everything from remote setups to clinical management and all the follow-ups for you through Telerespiratory. We're not just doing follow-up visits where we're just doing a vent check. We're tracking symptoms, we're tracking outcomes, we're tracking hospitalizations, we're tracking all the vent data. We've got integrations with all the vents on the market except for one. And so right now, any event that you're using except for that one, you're going to be able to collect data from, and it's going to save about 15 minutes off your visit because you don't have to go log into their platform anymore. So it makes it a whole lot easier and really makes it to the point where it makes sense to use products, use devices that have integrations with us because it makes your life so much easier. But having the ventilator integration says that everything that you do, from the clinical assessment to symptom management to tracking hospitalizations, or everything that we do for you in a model like this, goes into Nexus and we're collecting the outcomes for it. So in a Vent 360 model, it just says if you grow your event business, or if where you're at today you don't have enough respiratory therapists, we come in, we run the clinical playbook and the outcomes playbook for you. So we've already got the recipe. We know how to cook the biscuits. And so if you want us to come in and help you with that, then we can bring in our team, bring in the recipe. We become a subcontractor of yours and we track the outcomes for you. In that model, you might do a setup and then you go see them a couple times a year, once a year live in the home, and then we do everything else remotely. And because of that, we're going to have better compliance, less pickups. Our average length of service is 200 plus times, 2.5 times what the industry average is. So think about that for a second. If the industry average is that a ventilator patient stays on service from 8 to 9 months on average across the United States. In the Nexus software, we're around 26 months. Now, we see even more than that on neuromuscular patients. So the idea that you could have 2.5 times more time on the device for the patient means a couple things. One, you got less pickups because of non-compliance issues. You got less pickups because people don't feel like they're getting enough value, don't want to pay the copay. You got less pickups because of clinical reasons or mask issues, because the more you engage, the better outcome you have. And you have less pickups because if you do outcomes models like this, you see better engagement from patients, right? They feel better, their symptoms are managed, we're focused on what motivates them, what their motivational goals are. you're going to see patients engage more. And so what we see is that compared to the national average, 2.5 times that, much better outcomes. That means for you, a lot more money in your pocket and better outcomes for the patient. It's a win-win. So the idea of these models is that no matter where you're at in the process, if you say, I want to manage all the business myself, have my respiratory therapist be the one seeing the patient, that's fine. We license you Nexus, you use Nexus, and that's the end of the story. If you say, hey, I want to do this, but I'm not quite ready because I don't have the staff, or I'm not ready to run an outcomes program, then we come in with a Vent 360 style model and help you run that program, help you track the data. Eventually, maybe you take it back in-house, but or you outsource it forever. But what we find is in these relationships with Vent 360 and Vest 360, we have such a deep and close relationship with our DME partners that we continue to expand those programs, and we continue to see success with it. You've got consistency with your patient where we're tracking the compliance data constantly. And so where a respiratory therapist who's doing 30 CPAP setups, managing 10 vents, and then trying to do a bunch of follow-ups on vent patients, they're going to have a lot going on, and it's going to be really hard to log into the platforms to check compliance and see how that patient's doing. Whereas in Nexus, all that vent data is coming to one place. Our team is right there focused on it, and so we're able to capture issues much quicker and respond to them quicker. So we just see great outcomes. And the point is that no matter where you're at in the process, whether you want to do it yourself, whether you want us to help you manage your oxygen patients under the Telerespiratory oxygen program, Oxygen 360, or if you want us to help you manage and even set up your vent and vest patients, we can do that. And in doing that, you're going to have better outcomes. Your team is going to get trained on how to do these things. And eventually, if you want to, we can transition that back over to you. So it creates value in such a way that it allows you to continue to grow your business, continue to scale your business, at the same time to have outcomes that are sustainable, and they're going to create relationships with referral sources that are unmatched in the industry.